What if the next person to save your life isn't a person at all? Picture this. You're lying in a hospital bed, heart pounding, and instead of a doctor rushing in, a robot glides up to your side. No white coat, no stethoscope, just a smooth, silent machine with sensors for eyes and a brain powered by artificial intelligence. Sounds like a sci-fi movie, right? But this is real, and it's happening right now in hospitals across the US and around the world. Let's get one thing straight. These aren't the clunky robots from old movies. Today's medical robots are sleek, smart, and sometimes even a little bit charming. Some can navigate crowded hallways, dodging people and equipment with the same tech that powers self-driving cars. Others can perform surgery with movements so precise, they make even the steadiest surgeon look like an amateur. And the craziest part? They're getting smarter every single day. Take the Da Vinci surgical system, for example. This isn't just a fancy tool, it's a game changer. Imagine a surgeon sitting at a console, looking through a 3D camera that zooms in so close, you can see individual cells. The surgeon's hands control robotic arms that can twist, turn, and move in ways no human wrist ever could. The result? Smaller cuts, less pain, and faster recovery. Some patients are up and walking the same day. That's not just impressive, it's life-changing. But robots aren't just in the operating room. Let's talk about the real unsung heroes, the delivery bots. These little guys roll through hospital corridors, delivering meds, lab samples, and even meals. They use LiDAR, cameras, and AI to map out the hospital in real time, dodging obstacles and finding the fastest route. If a hallway is blocked, no problem, they instantly reroute, just like your GPS. And here is a wild fact. Some hospitals have reported that these robots save nurses hours every week, giving them more time to actually care for patients. Now, let's crank up the suspense. Imagine you're waiting for test results, maybe an X-ray or a CT scan. In the past, you'd have to wait for a radiologist to review the images, sometimes for hours. But now, AI can scan thousands of images in seconds, flagging anything suspicious. Some systems are so advanced, they can spot early signs of cancer or heart disease that even top doctors might miss. It's like having a superhuman assistant who never gets tired, never gets distracted, and never misses a detail. But here's where things get really interesting. These AI systems don't just spit out results, they learn. Every scan, every diagnosis, every outcome feeds back into the system, making it smarter and more accurate over time. It's like the world's best doctor, constantly studying, constantly improving, and always ready for the next challenge. Of course, it's not all smooth sailing. With every breakthrough comes a new set of questions. What happens if the AI makes a mistake? Who's responsible if a robot surgeon slips up? And can a machine ever really replace the human touch? These are the debates happening right now in hospitals, tech labs, and even courtrooms. The stakes are high, and the answers aren't always simple. But let's not forget the human side of this revolution. Meet Sarah, a nurse in a busy New York hospital. She used to spend half her shift running back and forth, delivering meds and supplies. Now, with delivery robots handling the grunt work, she has more time to actually talk to her patients, listen to their concerns, and provide the kind of care that no machine can replicate. For Sarah, robots aren't competition, they're teammates. And then there's the story of Michael, a patient who needed a complex heart surgery. Thanks to robotic assistance, his surgeon was able to operate with pinpoint accuracy, avoiding major blood vessels and nerves. Michael was out of the hospital in days, not weeks, and back to his normal life before he knew it. For him, the robot wasn't just a machine, it was a lifeline. So, what's next? In the second half of this video, we're diving even deeper. We'll reveal the most advanced features these robots have, the wildest things AI is doing in healthcare right now, and the real risks that nobody's talking about. Plus, we'll answer the big question: would you trust a robot with your life? Stick around, because the future of medicine is about to get even crazier. Let's pull back the curtain on what these robots and AI systems can really do. Forget everything you thought you knew about hospital tech, because the latest generation of medical robots are basically superheroes in scrubs. Some can see in 3D, using advanced cameras and sensors to build a real-time map of the operating field. Others have haptic feedback, which means the surgeon can actually feel the difference between healthy tissue and a tumor, even from across the room. Imagine a robot arm that can move with such precision. It can stitch a wound tighter than a human hair. No shaking, no fatigue, just pure, steady focus. Some surgical robots now use augmented reality overlays, projecting digital guides right onto the patient's body, so the surgeon knows exactly where to cut, what to avoid, and how deep to go. It's like having a GPS for surgery. There are even robots that can be controlled remotely, meaning a top surgeon in California could operate on a patient in Texas, or even halfway around the world, all in real time. The possibilities? Mind-blowing. Picture this. You walk into an A with chest pain. Before a doctor even sees you, an AI system has already analyzed your symptoms, medical history, and vital signs, flagging you as high risk for a heart attack. The doctor gets an instant alert, and you get treatment faster than ever. In some hospitals, AI is even being used to predict which patients are most likely to develop complications, sometimes hours or days before any symptoms appear. That's not just smart, that's life-saving. AI can spot patterns in data that humans might never notice. For example, researchers have trained AI to listen to a patient's voice and detect early signs of neurological diseases like Parkinson or Alzheimer, years before traditional tests would catch them. Imagine the impact: earlier treatment, better outcomes, and more lives saved. During the COVID-19 pandemic, hospitals deployed disinfection robots armed with powerful UVC lights. These machines could clean a room in minutes, zapping viruses and bacteria that might linger on surfaces. No risk to human staff, no missed spots, just relentless, automated protection. Some hospitals even used robots to take patients' temperatures, deliver food, or help with physical therapy, reducing exposure and keeping everyone safer. The best hospitals use AI and robotics to handle the repetitive, dangerous, or time-consuming tasks, freeing up doctors and nurses to focus on what really matters: listening, caring, and making tough decisions. It's not about choosing between humans and machines. It's about building the ultimate team. There's something comforting about a human face, a steady hand, a reassuring voice. But for others, the numbers speak for themselves. Robotic surgeries often mean fewer complications, less pain, and faster recoveries. AI-powered diagnostics can catch diseases earlier and more accurately than ever before. And as these systems keep learning, they're only going to get better. There have been cases where AI missed a diagnosis, or a robot malfunctioned mid-surgery. That's why every system is tested, monitored, and always has a human expert ready to step in. The goal isn't to hand over control, is to give doctors and nurses the best tools possible, so they can do what they do best. Imagine a world where every hospital is fully connected, where AI predicts outbreaks before they happen, and where robots perform surgeries so delicate they're measured in microns. Imagine healthcare that's faster, safer, and more personal than anything we've ever seen. That's the world NextAutonomy is all about. It's about humans and machines working together, each doing what they do best: The next time you see a robot rolling down a hospital hallway or hear about an AI that saved a life, remember, you're witnessing the start of something incredible. The future is here, and it's only getting smarter.